Good morning. My name's Josephine Roach, and I am doing a series of YouTube videos. I am a breast cancer advocate, an author, a speaker, and most importantly, I am a 6-year breast cancer survivor. In the last video, I talked about lumpectomy, getting my lumpectomy, and then some of the things, the bras that I purchased and the prosthetic that I purchased as well. And also then shared that some of that was also covered by my insurance. So I hope that you found that video helpful. So I'm going to continue on, and today I'm going to talk about preparing for chemotherapy. And there were specific things that happened after I got my lumpectomy. After I had gotten my lumpectomy, obviously the surgeon had called me back and gave me the results of the lumpectomy. And then a treatment plan was then discussed because I had to make an appointment with a medical oncologist. And I went there to meet him for the first appointment, and I brought somebody along with me. So, again, I would stress the importance of bringing a second set of ears with you because it would be great if you could just listen as the patient and the other person can take notes. And that's exactly what I did, and it worked out fabulously because I then could refer back to the notes because there were some things that I couldn't remember, and a lot of it was confusing, and all of it was very new to me. I worked as a physician assistant in internal medicine, and I learned a little bit about, breast cancer, and I did breast exams, I wrote prescriptions for mammograms for people to have, but I really didn't know the extent of breast cancer and all the types of breast cancer. So when everything was explained to me, this was something so new. Chemotherapy, radiation, it was all very new to me. And my oncologist really explained everything in great detail and made me understand what the next, I would say, well, it was almost year I was looking at. And the good thing was, he says that if I did the chemotherapy that he was recommending, followed by radiation, and then follow that by a oral medication, that my 5-year survival rate was 97%. So I thought that was amazing. I mean, to have a cancer diagnosis, but that to know that you are going to survive made me feel really great, and at a percentage rate of 97%. So I was happy after I met the oncologist and we discussed everything. So there were certain things that you had to prepare yourself for prior to going into chemotherapy. And those things included getting a port put in and having a MUGA scan done. So the port placement was an easy outpatient procedure, and the port just went, and it goes just right under your skin. I don't know if you can see my scar. See, it's so good. There it is. It's right here. It's very light, but that's where they put your port. It was right under the skin. They put an incision, and that's where they placed the port. And the port allowed easy access because once a week I was going for chemotherapy, and it's so much easier going through a port than having to get it IV. So that was really, a good thing. And interesting little story and side note is a friend of mine had told me that her port was like her little friend. And at the time I thought, oh my goodness, what does she mean by that? But really it became part of you, and it was making things easier for you when you received chemotherapy. So I got what she meant once I started my chemotherapy. So the port placement, there seemed to be no issue. That went fine. Yeah, it was uncomfortable. It's on the left side. I remember it bothered me initially when I would sleep. I would have problems because it is right underneath your skin, so you can feel it. But eventually you got used to it. I actually think I had it in for over a year before they took it out. So it was with me for a year or a little bit more. The second thing I had to do was a MUGA scan, and that was a test that you had done on your heart to check the strength of your heart. And that needed to be done because one of the medications I was getting was called Herceptin, and that affected heart. So that you had to get the baseline to see how good your heart was. And then as treatment went on, I would have other MUGA scans to determine if the ejection fraction, which is the ability to pump, was decreasing, because that's what the drug could potentially be a side effect. That would be a side effect. So that's why we had to do the MUGA scan, which is again a longer type test. And but again, I felt obviously it was very necessary because later on, I'll explain how that was very important, that test was in my treatment journey. So those were the things that I needed to do prior to starting chemotherapy. And chemotherapy was, when I was prepping for it and then anticipating it, was very scary because, again, the doctor, when he was explaining the chemotherapy, told me probably around day 16, 17 of chemotherapy, I would start losing my hair. And that was, again, something very traumatic for me. I think anybody learning that they're going to have to go through chemotherapy and lose their hair, it is a scary experience. So that was in the back of my mind. And then he also talked about neuropathy, which would be some burning sensation, numbness, tingling in your feet. And he did reassure me that that would reverse, but sometimes it doesn't reverse completely. So he was very honest with me with the side effects. And so I understood that that's what was to come. And then there was other side effects to the chemotherapy. I experienced a very dry nose. I would get, blood clots that would be coming out of my nose. Um, Very dry in general. So I drank a lot of water. I drank, wow, I think at least 8 glasses of water a day. So that helped. And I also walked. I made it a priority to walk every day during treatment, at least 20 to 30 minutes, because that, number one, is good for you, and it helps your cardiovascular system. Your heart is pumping. And I had my treatment, it was in the winter, and I just did laps around my basement. And I'm really proud that I did maintain walking every single day throughout my whole chemotherapy, which was 12 weeks, which, I was proud that I was able to do that. So that helped with, energy, because again, you get fatigued with that. But I was fortunate. The type of chemotherapy I had, which was called Taxol, and then the antibody treatment Herceptin, I didn't have any, I never vomited. I didn't experience nausea. So I thought I was very fortunate. I know obviously many people have different types of chemotherapy and they experience the nausea, the vomiting. So I thought I was very fortunate, in that regard. So I just wanted to come on and today talk about those things. This was prepping me for chemotherapy. And I think that by being prepared, you felt a little bit better because now this is the stage. Okay, now I had my surgery. Now we have to really concentrate on the treatment. And that is what I did. Like I said, I went to chemotherapy once a week. It was every Friday. and that lasted for 12 weeks. So knowing that, I finally had met my medical oncologist, he had explained in great detail what was going to be ahead of me for almost, 12 to 18 months of my life and beyond, because I had to take an oral medication. It made me feel good, but also it seemed like it was such a long time. But I'm here to also say that you think of it right when you're at the beginning, thinking this is such a long journey, but in relationship to the entire span of your life, which I hope is long, that it was just a bump in the road. As again, another friend had told me, it was just a bump in the road. And while you're going through it, it doesn't seem like a bump. But when you are on the other side and you look back, you realize, you know what? I got through it. And this is something I would also like to stress. Think of all the people that have gone through chemotherapy and all the people who have gone through it and got through it. So keep that in mind as you're going through chemotherapy. So I thank you for listening to me. If you found this helpful and you know somebody who could find it helpful as well, please share this. Subscribe to this YouTube channel, which is mine, and like it. And until next time, have a great day.